all of a sudden they're reinsured and they're confident. And all of a sudden, hey, maybe this is the best thing for my family. And maybe I can figure out how to make sure I do this. I know, is my wife in the room? Okay. After we were married, my wife got a job and she came home and she says, we can get health insurance and this is what it would cost. And by the way, I have to pay a little bit extra for you because you're my spouse. I'm covered 100%, but you're going to cost me extra. And I said, well, okay, well, I'll go without health insurance, no big deal. I was 28, didn't know any better. And so I said, okay, I'll go without health insurance. She said, no, you're not. And, because I had a very smart spouse who said, and she happened to be female, and females happen to be smarter than the males. And she, so she says, no, you're not. And I said, why do we want to pay an extra $75 every month out of your paycheck in order to provide me coverage? She says, that's what we're going to do. This is not a question about, that's what we're going to do. So anyway, one of the things in the research that we've done is we have found out that moms are probably the most important messengers. Now, everybody in this room has a mom. And when you start thinking about it, the mom many times is the best deliverer of the message. The thing that surprised me is what is the best way to motivate a 25-year-old to get coverage? It's the mom. The fiance comes in second. So the moms are really important. In fact, I've heard Enroll America make presentations, and they present it in such a way to say, this is a campaign about moms. If we can educate moms to the benefits of the health care reform, and we can get them to be our spokesman, we can go a long way to getting where we need to get. And so, just as we think about that, think about the important roles that mothers can have in regard to not just talking to their own family members, but also to others. There's something intuitive that women and moms know more than we do, meaning a white male. Okay? We just got to admit that we're probably down the totem pole, and we're just not where we need to be. So everybody has a mom. Everybody knows a mom. We really need to sit down around the coffee table and make sure that mom knows. And these are 4 messages. These are the 4 messages that actually can move a person across the line. So we got this arrow. How do we move a person from, frustrated, no way, Jose, I don't want to, this is not going to help me, and move them over to being confident. And these are 4 messages. Good benefits, don't have to worry about the fine print. It'll cover pre-existing conditions you can't be turned down, and it's a sliding scale as far as income. Now, who are going to be the first folks to sign up on October 1? We got these 5 groups. What's the first group to sign up on October 1? Carol, what? You think the 4th one? This one here? Yeah, the first one to sign up. The desperate and the believing. They're going to sign up. And they're the ones with the pre-existing condition. They're the ones that have been trying to get health care for years. They're the ones that have maybe been in the ER room, they got a chronic medical condition. They're going to show up. Now, how long do you think our health care plan or Obamacare, how long do you think it's going to sustain itself if these are the only people who show up?
13 minutes.
13. And when you look at that, that's only 13% of the population that are uninsured. So there are going to be people who are going to knock down the door to try to get in. But there's going to be a lot of people who are not going to knock down the door to get in. And they're going to need your tugging and your pushing and your touching in order to get in there. So we just got to think about that. It's going to take work. Now, in Tennessee, you've heard some different things, different numbers, so I don't want to totally confuse you, but I think this is really interesting. These 14 states, going from California, Texas, Florida, New York, Georgia, all the way over to Tennessee, 2/3 of the uninsured in this country live in those 14 states. So there's lots of different ways of looking at that. That's not a way of looking at it personally, but that's a way of looking at it statewide. It really is important that Tennessee does a good job. Now, I don't know if you've all seen this or not, but this is just sort of a way of looking at it and breaking it down. We've heard about Medicaid being very categorical, so if you're low income, poor parent, then you could be eligible. If you're a person with disabilities and low income, and also you're adult with no children, there's no way you can get on Medicaid in Tennessee. So when they were start talking and designing the ACA, this is where they were going to. Everybody, this would fill in the gap. Everybody below this would actually get coverage under the Medicaid expansion. Of course, now we're talking about the Tennessee plan. These folks up here, most people are actually covered by the employer, but these people up here would actually be covered through the new exchange options. If you're an undocumented immigrant, you don't have coverage. And then there's subsidies up there. So that's another way of looking at coverage in Tennessee. By the way, I think all these slides are going to be made available for you all or on the website. This is just one example. If you're twice poverty, you've heard us talk about 10% of poverty or 100% of poverty. If you're twice poverty, that gives you an idea of what it looked like for a family of 3. So that gives you some numbers as far as where they are. Okay? I'm going to move on because just of time, I know your stomach is there as well. There are different numbers. Basically, there's about 900,000 uninsured Tennesseans. And actually, when you start slicing the pie up, about half of those are below 138% of poverty, and half of those are above. And most of those people work. So we're talking about working people. The Enroll America is the nonprofit group. Get Covered America is our campaign slogan. So that's our campaign. So you'll hear Get Covered America, Enroll America. Basically, we're the same organization, but this is our sort of campaign. And you say, well, who's part of that? This is just a partial listing. You can go on our website. We actually have almost 100 different organizations across the country that are part of Enroll America. They are helping fund Enroll America, and they're helping us think about what we need to do. So there's providers, there are consumer advocacy groups, there's all kinds of different groups. What's the one thing they all have in common? No? There's for-profit up here too. What's the one thing? CVS, are they up here? CVS is for-profit. They're one of our partners. No, they don't care about health care. Actually, they benefit from enrollment. Okay. Look, the one thread that goes through all these folks is that if more people get enrolled, they will benefit. Enroll America, we actually are going to have staff in 10 states. So you see those blue states, that's where we're going to have staff. And all the other states, there's going to be no staff. Simply because we haven't been able to raise the money that we want to. If we could raise, $100 million or so, we could have staff in every state. So Tennessee is not a staff state, but I'm the Southeast, basically, manager and offering assistance to the southeastern states that are not part of, that don't have staff. So I'll be working in Tennessee as well as in Mississippi, Alabama, South Carolina, and Arkansas, Missouri, etc. And there's other staff people who will be working with other states. So how are we going to do our work? I'm going to move through these real quickly. We're going to establish a structure in Tennessee that's going to mimic, to a certain degree, the national structure with staff, but we don't have staff, so we've got to do it entirely with volunteers. And we're going to be trying to find the folks. Let me give you an example. By the way, we're going to go into details later on this afternoon if you want to come to my workshop. You'll have a chance to come there. And we'll get into details in regards to what that looks like. But what it amounts to is our national office has purchased a national database, and they're trying to figure out what are the characteristics in those databases that would tell us or indicate to us, or at least give us a high probability that this person living in this home is uninsured. And so there's nothing exists anywhere that tells us these people are insured or not insured or not insured. So we have to sort of develop that ourselves. And so we're at a high problem. We're trying to basically find the people who are most likely uninsured. So if we're going into a neighborhood and there's 40 homes, if we know that more than half of those homes, it's likely that they're insured, and the other half, they're likely uninsured, we don't want to knock on all those doors. So we want to just knock on the doors where it's a high probability that that person is uninsured. That information goes back into the database, we capture that information, we do some phone banking with that person, we remind them of an enrollment fair that's going to be nearby. In other words, we drive them to enrollment. The fact of the matter is that Enroll America is not going to enroll a soul, but we're going to drive people to enrollment areas. Okay, I got my time. Are we down to 5 minutes? Okay, we're time out. Gordon's over down. Okay. Well, this is really all I wanted to share with you. I wanted to give you a taste for what Enroll America is going to do. In order for us to assist you all in Tennessee, we're going to need tons of volunteers. And so we're going to be looking to you all to help us think about this and how to do this. And it's going to be going from community to community. So it's not so much, that there's one entity in Tennessee that's going to be directing this whole thing. There will be entities in Tennessee that will be helping to coordinate this, but the people that are going to have to do it, we are not going to have enough navigators. We're not going to have enough certified application processors. The reality of it is that, I know, I hear you. The reality of it is the only way we can get there is through volunteers. So let's come back if you want to join me in the workshop this afternoon. Is it time for lunch for the second group?